Yeah, Professor Malik, thank you very much for the introduction, and thank you also very much to the Academy for the invitation to speak today. It's a great honour. My understanding of One Health is the integrated working between medical professionals, veterinary professionals, and those concerned with the environment. And the third arm of that is one that, in the context of One Health, too often is forgotten. Not by this panel, I know, but on the ground is too often forgotten. And I think that integrated working, which sounds very simple, is actually very challenging if we're going to have, we need to deliver truly equitable working between all of these different areas. And it is more complicated than just doctors and vets working together, which I think in some ways was a starting point for One Health. It's clear that the majority of infections that pose pandemic threat to humans come from animals. And so in order to understand how to address those threats, we need to understand what is in animals, how they might transmit to humans, and therefore that means understanding the interactions between humans and animals, which may be direct or maybe through the environment, or maybe through vector species such as mosquitoes, ticks, and other invertebrates. And all of those interactions can be influenced by a wide variety of different influences. My interest and role within One Health is primarily as a veterinary researcher. As Malik introduced me, I'm based in the University of Cambridge. I'm a university researcher. Although within my country in the UK, I spend a considerable period of time in my life advising government around issues relating to infectious diseases generally, and in particular taking a One Health approach around disease prevention. Although my group is active in research, particularly in animal diseases within the UK, a greater level of activity is in understanding the ecology of infections in wildlife, particularly bats in sub-Saharan Africa. And we have very well established collaborations globally, but in terms of the primary area that we've been working in Ghana in West Africa. And over the last 10 or 15 years with a number of collaborators, both from within the UK, from the US, from Australia. We work with a number of institutions in Ghana who are working and living with bat species infected with, as many of us know and actually have in our own environments too at home, are infected with a number of infections which could, in the long term, pose risks to human health. As well as those specific infections, where we have taken a multidisciplinary approach to their investigation, and actually a lot of our work has involved disciplines as diverse as mathematical modelling to understand the dynamics of the infections, both in wildlife species, where they're not static, they're very dynamic, just as infections are dynamic in human populations. Medics, vets, epidemiologists such as myself, immunologists, virologists, but also very importantly in terms of trying to understand the interaction between human and animals, which is a major determinant of risk of transmission. We also work very closely with social scientists to understand what shapes people's behaviours. And I look forward to the panel discussion more generally. Thank you very much.